My name is Joe Ortona, and I'm the chair of the English Montreal School Board. The past 21 months have been challenging for everyone across the globe. I want to thank all of our stakeholders at the EMSB for performing above and beyond the call of duty throughout this pandemic. I'm referring to our staff, students, parents, and leadership at the Council of Commissioners level. We all know that a crucial component to getting back to something close to normalcy are vaccines. We work extremely closely with the CEUS Health Network. Towards the end of the last academic year, we collaborated with vaccination clinics for our high school students. We are now doing the same at the elementary level, and the process is going very well. Yes, we encourage everyone to follow the vaccination procedures set out by health authorities. With that in mind, we're pleased to present this panel featuring our Director General and two physicians who are also EMSB parents. On that note, I will turn things over to our moderator, Michael Cohen. Thank you.
Thank you, Mr. Ortona, and very pleased to welcome the EMSB family to this very important video presentation. My name is Michael Cohen. I'm the manager of marketing communications for the EMSB. Joining me right now, Nick Katalifos, who is our Director General, Dr. Earl Rubin, Director of Infectious Diseases at the Montreal Children's Hospital, and Dr. Debbie Schwartz, who is a family physician. Both Dr. Rubin and Dr. Schwartz are also EMSB parents. We're very privileged to have them, and we're here to talk about COVID-19. I'm going to ask first Mr. Katalifos, our Director General. Vaccination clinics started for our students aged 12 and over last June, and now those over 5 are eligible. So the EMSB has worked very closely with our CEUS network to assist these efforts. What do you have to say about that?
Well, first of all, I have to say that it's been a privilege to work with the CEUS network. They've been extremely supportive of us as a school system. It's really important to see that the two sectors are working together in terms of education and health. So we're very grateful for all of the guidance and the support that we've received from the CEUS network. But by the same token, I want to take a moment to just acknowledge and congratulate our schools for all of the work that they've put into this, in particular our in-school administrators and the staffs, all the staffs, the staff members in our schools that have worked really hard to make the vaccination campaign a success, and indeed to make sure that all the protocols are in place to keep the kids as safe as possible. So everyone has worked very well together, and it's a big burden that everybody in the schools is carrying, but I'm very proud of the work that's been done.
Thank you. I'm going to ask Dr. Rubin and Dr. Schwartz the same question, so you can each answer in your own way. Very simple question. How important is it to get vaccinated? Dr. Rubin, start with you.
It's not such an easy question. It's a very easy answer, though. It's essential that we do what we can, not only to protect the kids, first and foremost, but to protect the people around the kids, the parents, the grandparents, the extended family, and the community at large, but also to allow kids to lead as normal of a life that, at least of how we knew it, also needs to be taken into consideration. We don't want schools closed and borders closed, and we want everybody to enjoy life to the maximum. And at this point in time, the greatest defense we have against COVID is universal vaccination to really try and bring things down.
Dr. Schwartz?
I couldn't agree more. I'd say that Dr. Rubin took the words out of my mouth. That's exactly, my opinion. I think that universal vaccination is of crucial importance here. I vaccinated my own school-age children specifically for the reasons mentioned, to protect those around them, to allow them to get back to their lives as normally as they can, to be able to avoid quarantines and class closures, which are incredibly disruptive to children's lives. And, especially to protect those around them. We know that COVID doesn't affect, fortunately, the symptoms in children are or more mild than an adult, but that doesn't mean that they shouldn't be vaccinated for those reasons, because those reasons are extremely valid.
Okay, I'm going to stay with you and I'm going to ask Dr. Rubin to answer the same question. Okay. What do you say to the people out there who are either anti-vaxxers or vaccine hesitant? There is a difference between the two, but it amounts to the same thing. Dr. Schwartz, we'll start with you.
It's really difficult. I actually you're catching me on a day where I actually dealt with quite a bit of this during my work day. It's very challenging. It's becoming very challenging to treat patients with COVID who are symptomatic and who have not received the vaccine. It's becoming very difficult as a physician to maintain my sympathy for the patient's symptoms when it's something that is avoidable. So I find that's becoming really challenging. And, you know, I try to take my time to explain to patients the importance of vaccination. So I think that for a lot of people, they feel that COVID is not such a big deal and it won't affect them greatly, and that it's like a flu. But I try to use these simple explanations to encourage them to get vaccinated, to teach them the importance of vaccination for their loved ones, for the people around them, to protect them, to protect transmission, and to try to get us out of this hole, because, you know, we really felt that vaccination would get us out of the hole that we're in. And I think we as physicians were also hopeful for it, but unfortunately we're still sort of stuck in this position because of the remaining people that have yet to be vaccinated. So I try my best to teach people that it is a safe, it's efficacious, that it's just because it was developed rapidly does not mean that it is any less safe than any other vaccine out there. And I really try to focus on those points to teach them to go ahead and get vaccinated, because it's now better than ever, now better than later. And even, you know, once they are in the emergency room sick, symptomatic, I encourage them to still, that's the time to still go
Yes.
ahead and get vaccinated once this acute phase is over, because they can, you know, catch it again, you know, down the line.
Well, Dr. Rubin, you and I have a few things in common. We both graduated from Wager High School together in the same year. And, but
Don't tell
also we
anybody
both,
what year that is.
that's it, 1980, Dr. Rubin. So we've told our age. But as well, we both had COVID last January. I believe you had it around the same time as I did. We didn't know that until we bumped into each other in the grocery store. And then, of course, you were in the news community. So you know your comments about the importance of vaccines.
Yeah.
And dealing with the people who are vaccine hesitant or anti-vaxxers. I don't know if you've come into contact with any people like that.
Yeah. So I think that you can't really put them together, people who are, and this is my opinion, the anti-vaxxers, there's no matter what you say, you can't convince them. Somebody, on the other hand, who is vaccine hesitant, to me, is hesitant and nervous and open to discussion and to understand the pros and the cons. And so for me, the ones who will come to me are the ones who are vaccine hesitant or referred to me, who want to hear the pros and cons and who want to have their questions answered. Those who are adamant, who believe, for whatever their belief system is, that the vaccines are unsafe and I will never do it, are not open to that discussion. So to me, they're two very different groups of people. And from my perspective, the most important thing is to listen and not to pass judgment, and to say, I'm here, ask me the questions, take the opportunity, tell me what your concerns are, and let's see if we can address each concern one by one, either by science, in terms of history, whatever is documented. And I really try not to pass judgment. Having said all that, I also use, like you said, Mike, in terms of, I was hospitalized with COVID. So I got infected January 6th. I was admitted on day 8 of my illness, and the day after my admission is when I got the call saying, "Good news, Dr. Rubin, your appointment for your vaccine is tomorrow." As we were waiting, and we're almost a year later, as the healthcare workers are anxious for their booster shots, and we're back in, it's kind of Groundhog Day. Like, when am I getting my booster? When am I eligible? So I can tell people, and for those who are vaccine hesitant, what it is truly like to get quite sick with COVID, how terrifying it is being in hospital and trying to and pray that I don't end up in the ICU and intubated, which thankfully I did not. But I use my own personal experience. But really, I think those who are hesitant are open to discussion. Those who do not believe in it, unfortunately, it's hard to convince them otherwise.
Right, well, hopefully some of those people who are vaccine hesitant are watching this video today. And I can attest, I didn't have to be hospitalized, but I was home for 28 days and I don't ever want to have COVID again. It was a miserable experience. I can tell you that. And it's made me very, very, very pro-vaccine and try to be safe as possible. Mr. Katalifos, for the past year and a half, we at the EMSB have been able to keep our schools open, and we've maintained a very low infection rate. I guess that's a signal that our staff and students are following health protocols pretty well.
Well, absolutely. And again, and I'm listening to what both our colleagues from the medical field are saying. And I think that we've been able to succeed, from that perspective, Mike, in terms of keeping our schools open and keeping the infection rate down by listening to our health professionals and taking very much a science-based approach and doing what we have to do in terms of protocols from the pre-K level all the way up into our AVS programs or adult ed programs. So it's critical that we work together and that we listen to what the medical experts are saying. When the pandemic started, I was still working as a principal at the time. I was in the school at Wager. So I got to live that with my staff at Wager in terms of all the protocols that were put into place. And we were very grateful for the fact that we had guidelines. We had information in terms of what can be done to keep everybody as safe as possible. And then when the entire vaccination campaign began, obviously from my perspective at least, and I say this not just as an educator, but as a parent, I listen to what the doctors have to say. I listen to what the health sector has to say. And I certainly got vaccinated. My family got vaccinated because we felt very strongly that we had to do everything possible, not just to keep ourselves safe, but to also make sure that we don't pass on the disease to others. So I think from that perspective, we all have to continue to work together. And from the perspective of the school system in particular, I think that we've done a good job so far, and we're continuing that work. It's not over. That's certainly obvious. There's a lot that continues to be done and needs to be done. But we're going to keep working with all of the various CIUSs, if I can use that term, and Santé Publique to make sure that we keep everybody as safe as we can. And part of that is going to be to participate in those vaccination clinics for our elementary schools right now that are running. Things are going very, very well. And I know I said it earlier, but I'm going to repeat it. I'm going to thank all of our in-school administrators as well as the staffs in all of our schools for the work that they're doing right now to facilitate that process, because it's a great deal of work. And I'm also going to thank the parents who are doing what they need to do and who are trusting us when it comes to these clinics.
Well said.
Mike,
Dr. Rubin?
Yeah, so a couple things just to comment on what Nick was saying. At the present time, 25%, almost 1/4 of all positive tests in Quebec are in school-age kids, those who are now eligible to be vaccinated. It was one thing to say before the Pfizer vaccine got approved for the 5 to 11-year-olds, there's only so much you can do. But as we see the numbers rising, the outbreaks, it's all related to school age kids. The breakthrough infections that we're seeing, at least in healthcare workers who are doubly vaccinated, is because their kid has COVID and they're living and they cannot separate from them despite the two vaccines. Now, having said all that, thankfully, kids do not get that sick. And that's a big question why parents say, why should I do this? My kid doesn't get that sick and I'm too nervous about the vaccine. So it's true that kids do not get that sick. However, 0.3% of those who are infected do get hospitalized, and a death rate of 0.002%, so very low, very different when you compare it to adults or immunocompromised or the elderly. But the bigger issue is the post-inflammatory syndromes called MISC or PIMS that we see very sick, critically ill kids in the ICU, anywhere from 2 to 8 weeks after their COVID infection, which may have been nothing. So just to kind of underline the fact that, yes, kids don't get that sick, but some do, that 25% of the positive cases are in vaccine eligible school age kids. And the increase in numbers that we've been seeing in the last week or two is really driven by this population that is eligible to be vaccinated. Just want to underline that.
Yeah, it's a good point. And I was speaking to someone I know who's the parent of 2 children in one of our schools, who he did not get vaccinated. He said his kids are not going to get vaccinated because they don't get that sick. But I told him, do you want to be that one parent whose kids are very, very ill? Do you want to take that risk? Do you want to roll the dice? And he kind of was, didn't have a lot of words to say. Dr. Schwartz and Dr. Rubin, just a couple of more questions. I do hear from a lot of parents. And what do you say to this mom? She had COVID last spring. She refuses to take her first shot because she believes, and she had COVID in April, that she's immune from COVID, and also doesn't recognize the fact that even if she had immunity at some point, she could still spread the disease. What would you say, Dr. Schwartz, to that person?
Well, I would explain that the immunity, unfortunately, does wane. So we think that the immunity starts to wane actually at the 6-month mark, even before. And so I would explain that, and that of course she can still pass on COVID to others. And I think what, Dr. Rubin brought up is so important, because we all, maybe we should really focus on the fact that, at this point, getting COVID or becoming very sick from COVID is preventable. We have a vaccine for that. And we really need to, make people remember that and think about it. We've come past many other diseases because we have a vaccine for that. We have a vaccine for measles. We have a vaccine for mumps, for rubella, for polio, for varicella. And now we have a vaccine for COVID. And it's no different. And I think that we should feel so fortunate. And I feel so fortunate that we have a vaccine for that. And I feel so fortunate when the vaccine was approved by Health Canada for ages 5 to 11, because of A, because I have children of that age group, but B, because, and more importantly, because this is the group right now that is driving the outbreaks. So I feel very fortunate, and I did not hesitate for a moment to vaccinate my own children. And when Dr. Rubin talks about his own experience with COVID, I think that that is very important, and I think that people do relate to that. And I use my own personal stories because I do think people relate to it. And I think people come and they want to know what I'm doing in my family. And I most definitely vaccinated my 2 older boys and will be vaccinating my 3rd boy once he turns 5. Happy birthday.
Wonderful. Well, Dr. Rubin, I kind of asked you this question myself by email, and we corresponded last spring about this because this person is the same person that was asking me that question. So what would you say to this person who believes that she is still immune to COVID because she had one vaccine and that's enough and she doesn't need to have a second one?
So this person had one shot, but I thought she had
No,
COVID.
sorry, this person, sorry, I misspoke. This person had COVID,
Right.
but will not have that first shot. She believes that she doesn't need to have a vaccine because she's had COVID and that she's immune forever.
Yeah, so kind of like Debbie said, in terms of if she would have asked me the question 1 month, 2 months, 3 months, 4 months after having COVID, I'd say at this point in time, you're good. But we do know that there is waning immunity, and we don't know exactly how long. Initially, we were saying 3 months, now we say 6 months. There is some evidence that it may be even as long as 9 months, but it's not a plateau and a cliff and you fall off. There's just going to be a gradual decline in this immunity. And as you decline, you are susceptible to getting it again. And what's really important to understand is that the immunity that is created after just one dose of the vaccine after having had COVID is a tremendously strong immunity.
Yes.
2 doses, probably even longer, and a more robust response. As Omicron is on the horizon and other variants may be in the future, we don't know exactly who's going to be immune from what, but there is a belief that those who are vaccinated, even if the current vaccine doesn't cover Omicron, that it is a milder form of the disease. So there, people are asking that question now. Their Omicron is coming. What do we do with that? Well, the answer is that at the present time, 99.9% of COVID that is here is Delta, and that is in the here and now. And so we need to protect the here and now, and we are hoping, and hopefully we will have more data to understand it better in the next few weeks, is will that provide absolute protection against Omicron, or will it provide partial protection in that you'll get milder disease? And so there is still a benefit for those who are saying, well, I'm not going to take that because there's going to be a new variant, or right now it really looks like it is providing protection that we need now, and will hopefully provide some protection in the future. But we don't know what the future is going to bring.
And also not to forget that the vaccine that you get right now, this doesn't, absolve you from getting vaccines in the future to protect you against future variants. Just like the flu vaccine protects us against new variants of the flu every year, I think that COVID will be a very similar situation. So I would absolutely recommend against holding off on a future vaccine with the hopes of covering against more variants.
Terrific messages from both of you. Mr. Katalifos will give you the closing word. And people, we are updating our website. You've got staff that you've basically assigned almost regularly to work almost full time on COVID. So we've got a good team, and we're updating our website on a regular basis.
Well, first of all, Mike, I want to thank you and our 2 guests for everything that was done this evening. A lot of our parents have all sorts of questions about this topic, so I think this is going to go a long way towards alleviating some concerns and perhaps offering some explanations. I'm going to repeat what you said, Mike. We've got a big team that's working very, very hard on this, not just in the schools, but at the school board as well, in terms of organizing this entire effort. And if the public wants more information about what we're doing at the EMSB, they can refer to our website at emsb.qc.ca and basically go to our COVID-19 section, and they'll see every single measure that we have in place, as well as information about the vaccination campaigns and so on. But ultimately, I'll take a moment again to say and acknowledge the work that's being done in the health sector, and the fact that we're being supported in such a big way by our colleagues in that sector. So thank you to them, and thank you to our two guests again tonight.
Thank you all for joining me, and stay safe.